Hello dear students, my name is Girija Prasanna Sahu. I am currently doing PhD in Pharmacology and Toxicology in Naipur SS Nagar Mohali. So I done my masters from Naipur Mohali itself in Department of Pharmacology and Toxicology. I qualified GPAT 2021 with All India rank 828. Then again I qualified Naipur J 2021 with All India rank 64, and then I joined Naipur Mohali. So after that I completed my masters over there. Then in 2023 I again qualified Naipur J PhD 2023 with All India rank 19. Then I joined as a research scholar in Naipur Mohali. Currently I am pursuing my PhD in Naipur Mohali. I have been teaching experience in both online and offline mode. I have around 1 year of teaching experience in online and 6 months of offline teaching experience. So I will basically cover your general pharmacology syllabus. So in there we will study all the detail about pharmacology. So whenever we are study any book, before that first हम लोग क्या करते हैं कि ABCD स्टार्ट कर पढ़ने से पहले, वर्ड्स पढ़ने से पहले। सिमिलरली जब हम फार्माकोलॉजी पढ़ने जाते हैं, पहले हम जनरल फार्माकोलॉजी को समझना बहुत जरूरी है। So to understand general pharmacology, we have to read it in detail in a proper manner. Study in general pharmacology in different heading. Like we first will study what is in pharmacology, what are the route of drug administration, then how the drug will absorb, then how the drug will distribute in your body. After distribution, how the metabolism and the excretion process takes place. Then how the route of and kinetics of elimination will study. After that we'll study drug mechanism of action. Receptor is very much important, as you know that before when a drug we consume, it has to be bind to any receptor to show its action. So receptor के बारे में हम डिटेल में पढ़ेंगे। इसके अलावा डिफरेंट टाइप ऑफ रिसेप्टर के बारे में पढ़ेंगे। ड्रग रिएक्शन, एडवर्स ड्रग रिएक्शन, व्हाट आर द ड्रग डिस्कवरी प्रोसेस, प्री क्लिनिकल इवैल्यूएशन फेज, क्लिनिकल इवैल्यूएशन, क्लिनिकल ट्रायल्स एंड फार्माकोविजिलेंस we will also read. Then after that we will study about autonomic nervous systems in autonomic nervous system under the heading of peripheral nervous system. So we'll first study what is autonomic nervous system, what is the neurohumoral transmission, what are the different type of neurotransmitter, parasympathetic system, sympathetic system, sympatholytic system, neuromuscular blocking agent, local anesthetics, and drug used in different type of condition like myasthenia gravis and glaucoma. All this will covered under the autonomic nervous system topic. Then in case of CNS, will also study the different heading under different heading like general anesthetics. When आप लोग, जब आपको पता होगा कि कोई एक मेजर सर्जरी के लिए जनरल अनेस्थेटिक मोस्टली यूज होता है, तो जनरल अनेस्थेटिक्स ड्रग्स देने से पहले कुछ ड्रग्स जो होते हैं जो प्री अनेस्थेटिक के जैसा यूज होता है उसके बारे में पढ़ेंगे। अदर देन दैट सेडेटिव एंड हिप्नोटिक्स, central acting muscle anti-epileptic drugs, alcohol and disulfiram, antipsychotic drugs, anti-depressant drug, anti-anxiety and anti-manic drugs, drugs that are used in different conditions like Parkinson, and opioids and opioid agonist and antagonist. Then discuss about cardiovascular system. We'll study in detail about how the heart failure, what is heart failure, and what are the drugs that used for treat heart failure, and what are the hemodynamics and electrophysiology of heart. Other than that, we also study the drugs that used in treatment of hypertension, angina, arrhythmia, drugs that used as anti-hyperlipidemic drug that has atherosclerosis. Other than that, hematinics, coagulant and anticoagulant, and drugs, plasma volume expanders, diuretics and antidiuretics. Next, we'll study about autocoids, and you know that autocoids are called as local hormones. So क्या पढ़ेंगे like we'll study about histamine and its antagonist, serotonin and its antagonist, prostaglandins, thromboxane, leukotrienes, bradykinins, non-steroidal anti-inflammatory gout drugs, anti-rheumatoid drugs. Then pharmacology acting on endocrine system, because हमारा hormonal जो system होता है वो basically coordinate करता है हमारा पूरे बॉडी को. So we know that there are different type of pituitary hormones and their inhibitors, thyroid hormones and their inhibitor, hormone regulating plasma calcium levels, then insulin and oral hypoglycemic agent, corticosteroids, androgen and anabolic steroid, estrogen and progesterone, oral contraceptive pills and drugs that are used in case of okay. Okay, so let us study about anti-asthmatic drugs. You know, a respiratory disease which is basically associated with cough and wheezing, shortness of breath and many other symptoms. तो आप लोगों को पता होगा जो अस्थमा है एक एयरबॉर्न डिजीज है. बेसिकली जो हमारा एनवायरमेंटल पॉल्यूटेंट हो गया या एनी एयरबॉर्न एलर्जेंस और डस्ट पार्टिकल व्हेन एंटर into your body, that will behave as a antigen. Okay, when this antigen binds to the dendritic cells, and these are the different type of cells, immunocells, that are associated with immunomediated reaction. When this antigen binds to the dendritic cell, they will activate Th0 cells, a type of T cells which is also called as native T lymphocyte. इसको हम नेटिव टी लिम्फोसाइट बोलते हैं. एंड ये जो नेटिव टी लिम्फोसाइट्स है ये अपना रिस्पॉन्स शो करता है बाय एक्टिवेटिंग TH1 and TH2. TH मतलब T helper. So TH1 is activated when with the help of interleukin 12. Okay, so when TH1 response activated, it will release interferon gamma, interleukins 2, lymphotoxin that will activate your cell mediated immunity and also causes lymphocyte infiltration. That means the migration of lymphocyte to the infected area. Then after that there will be a TH2 response. तो TH2 response में अपना क्या होगा, interleukin 4 and interleukin 13 का activation होता है and that will activate immunoglobulin E, and due to this immunoglobulin E activation it causes mast cell activation, and this mast cell activate basophils and basophils will release histamine, prostaglandins and leukotrienes. So that these are basically inflammatory markers, or we also called it as autocoids. We will causes bronchial hypersecretion and airway obstruction, and that will leads to development of asthmatic condition. And what are the symptoms that we'll see in case of asthma? That is cough and wheezing sound, shortness of breath, chest tightness and pain, trouble in sleeping. Okay, let us discuss about drugs. As we know that there is a immunomediated reaction is occurring, and due to this immunomediated reaction, bronchoconstriction is occurs, that is airway obstruction. So to treat that condition, we have to administer bronchodilators. So there are three different class of bronchodilator, that is methylxanthine, where the drug like theophylline, theobromine are there. Then anticholinergic drugs like ipratropium bromide, tiotropium bromide. Then beta-2 stimulant like salbutamol, salmeterol, albuterol class of drugs will be there. And we also study, as we know that immunoglobulin E is the major antibody or immunoglobulin that is activating the mast cells. We can also block that immunoglobulin E by giving a drug called omalizumab. It is a monoclonal antibody which is given to block the action of immunoglobulin A. Then mast cell activator, here is mast cell activation is occurs. So to prevent that, we have to stabilize the mast cell. So we can stabilize the mast cell by giving chromoglycolate sodium, nadochromyl and ketotifen. Then leukotriene receptor antagonist, because there is activation of your leukotriene. So leukotriene receptor antagonist can be given like montelukast and gemprelocast. So these are the overall class of the drugs that basically given to treat the asthmatic condition. Thank you.